Swaziland is a landlocked country in southern Africa. It has a population of just above 1 million people, with a recent figure of 25.8% of the population between 15 and 49 being HIV positive. The government of Swaziland, with technical support from UNAIDS and UNFPA and financial assistance from the European Union, have embarked on a program linking sexual reproductive health with HIV at policy, system and service level. Matsenjeni Health Centre in southern Swaziland has been recognized by the Swaziland Health Ministry as one of the 5 centres of excellence to link HIV and SRH services.
We're here on assessment for the 5 centres of excellence. The country embarked on the SRH linkages based on a survey report that came out and looked into the limitations and the gaps that were identified on SRH services and the HIV, yet we are mostly seeing clients of both conditions in one facility. We were able to select 5 facilities, looking at the representation of the facility levels in the country, from the root level to the national level.
Most HIV infections are sexually transmitted or associated with pregnancy, childbirth and breastfeeding. With this in mind, the efforts of addressing both HIV and sexual reproductive health may reinforce mutual progress in both areas.
A lot of people would be saying integration has always been in existence in the country. Yes, it has, and it's not here to change that. We just want to identify any strengths in each and every one of the facilities. We are the strongest in SRH services or HIV services, and where we can enhance or support them. And then look into the weaknesses in all the facilities. Where one is weak, then we can see how we can build. Could it be infrastructural, capacity building? Could it be supplies, equipment, mentorship, supervision? So it's more like a learning curve for all facilities.
Our role as UNFPA in the project is to provide some kind of technical support to the Ministry of Health in terms of actually implementing this project. This is an initiative supported by the European Union in Swaziland, so which means we have some kind of links with the European Union in terms of activities that we implement, and also in terms of actually bouncing back and forth ideas around how best can we actually implement the project. Even though it would be still too early for us to actually begin to say we can actually point out at major results, but we do have some good lessons which we've actually learned from the project. One of them being that when we talk of SRH, HIV, linkages and integration, it is something which is bi-directional, in the sense that, you know, when you go to a facility, you may find that a facility is stronger in terms of SRH services, and another facility might be stronger in terms of HIV services. So you could approach integration in terms of the strengths of the facility at which you are going to be working on. And one of the other things which we could point out as a good lesson which we've learned from the project is the initiative taken by the Ministry of Health to take the lead in the project and also to convene all stakeholders. So we have such a very good pool of people who can actually contribute in terms of the better understanding of SRH, HIV, integration and linkages in the country.